Urinary tract infections, or UTIs, are a common health issue that can affect anyone, though they are more frequent in women. But what exactly happens inside your body when you get a UTI? In this video, we'll take a detailed journey through your urinary system to understand the process from the very beginning. We'll explore how bacteria enter the urinary tract, what symptoms you might feel, and how your body responds to fight off the infection. Let's start by understanding the basics of the urinary tract and why it's vulnerable to infection. The urinary tract is made up of several parts: the kidneys, ureters, bladder, and urethra. These organs work together to filter waste from your blood and remove it from your body as urine. The kidneys filter the blood, the ureters carry urine to the bladder, and the bladder stores it until you're ready to urinate. The urethra is the final tube that carries urine out of your body. Each part plays a crucial role, but also presents an entry point for bacteria, especially the urethra, which is closest to the outside world. Most UTIs are caused by bacteria, commonly E. coli, which normally live in the digestive tract. These bacteria can travel from the anus to the urethra, especially in women due to anatomical proximity. Once bacteria reach the urethra, they can move upward into the bladder. Activities like sexual intercourse, improper wiping, or even holding urine for too long can increase the risk of bacteria entering the urinary tract. The journey begins at the urethra, but the infection can quickly spread if not addressed. Once inside the urethra, bacteria use tiny hair-like structures called fimbriae to attach themselves to the lining of the urinary tract. This attachment helps them resist being flushed out by urine flow. The bacteria then begin to multiply, forming colonies that can invade deeper into the tissue. This is the first step in establishing an infection, and it's why early intervention is so important to prevent the bacteria from spreading further. As bacteria begin to multiply, your body's immune system quickly detects the invaders. White blood cells rush to the site of infection, releasing chemicals to attack and destroy the bacteria. This immune response is what causes many of the classic UTI symptoms, such as pain, burning, and frequent urges to urinate. The inflammation in the urinary tract lining is a direct result of your body's attempt to fight off the infection. The first symptoms of a UTI often include a strong, persistent urge to urinate, even when your bladder isn't full. You may also notice a burning sensation during urination, cloudy or strong-smelling urine, and sometimes even blood in the urine. These symptoms are the result of inflammation and irritation caused by the infection and your body's immune response. Recognizing these early signs is key to seeking prompt treatment and preventing complications. Pain is a common symptom of UTIs, often felt in the lower abdomen or pelvic area. This discomfort is due to the inflammation of the bladder lining and the pressure from frequent urination. Some people may also experience back pain if the infection spreads to the kidneys. The pain can range from mild to severe, and it's one of the main reasons people seek medical attention for UTIs. When bacteria reach the bladder, they cause a condition known as cystitis, or bladder inflammation. The bladder wall becomes red, swollen, and irritated, which intensifies the urge to urinate and the pain experienced. This inflammation is a direct result of your immune system's efforts to eliminate the bacteria, but it also makes the bladder more sensitive and reactive. During a UTI, you might notice changes in your urine. It can become cloudy, dark, or have a strong odor. Sometimes, you may even see traces of blood. These changes are caused by the presence of white blood cells, bacteria, and sometimes red blood cells in the urine. Monitoring these changes can help you and your healthcare provider assess the severity of the infection. If the infection is more severe or spreads beyond the bladder, you may develop a fever and a general feeling of being unwell, known as malaise. Fever indicates that your body is mounting a stronger immune response, and it can be a sign that the infection is moving toward the kidneys. At this stage, it's important to seek medical attention to prevent further complications. If bacteria continue to ascend the urinary tract, they can reach the kidneys, leading to a more serious infection called pyelonephritis. This condition can cause high fever, chills, back or side pain, and nausea. Kidney infections are more dangerous and require prompt medical treatment to prevent permanent damage or the spread of infection to the bloodstream. Your body has several natural defenses to prevent UTIs. The flow of urine helps flush out bacteria, while the lining of the urinary tract produces substances that inhibit bacterial growth. In addition, the immune system is always on alert, ready to send white blood cells to attack any invading microbes. These defenses work together to keep the urinary tract healthy, but sometimes bacteria can overcome them. Women are more likely to get UTIs than men, mainly because their urethra is shorter and closer to the anus, making it easier for bacteria to enter. Hormonal changes, sexual activity, and certain types of birth control can also increase the risk. Understanding these factors can help in taking preventive measures and recognizing symptoms early. While less common, men can also develop UTIs, especially as they age. Factors like an enlarged prostate, urinary tract blockages, or catheter use can increase the risk. Men may experience similar symptoms, but infections are often more complicated and may require more extensive treatment. Children can also get UTIs, especially girls and infants. Symptoms may be less obvious, such as fever, irritability, or poor feeding in babies. Prompt diagnosis and treatment are important to prevent kidney damage in young children. Parents should watch for any unusual signs and consult a healthcare provider if they suspect a UTI. Elderly individuals are at higher risk for UTIs due to weakened immune systems, chronic illnesses, and sometimes reduced mobility. Symptoms can be atypical, such as confusion or sudden changes in behavior, rather than classic urinary symptoms. Recognizing these signs is crucial for timely treatment and preventing complications. If a UTI is left untreated, the infection can spread from the bladder to the kidneys, and in severe cases, enter the bloodstream, causing sepsis. This can be life-threatening, especially in vulnerable populations. Early treatment with antibiotics is essential to prevent these serious complications and ensure a full recovery. Diagnosing a UTI typically involves a urine test to detect bacteria, white blood cells, or red blood cells. Sometimes, further tests like urine cultures or imaging studies are needed, especially if infections are recurrent or complicated. Accurate diagnosis helps guide effective treatment and prevents unnecessary use of antibiotics. The main treatment for UTIs is antibiotics, which target and kill the bacteria causing the infection. It's important to complete the full course of medication, even if symptoms improve, to ensure all bacteria are eliminated. Drinking plenty of fluids and resting can also help your body recover more quickly. Antibiotics work by targeting the bacteria's cell walls or vital processes, effectively killing them or stopping their growth. As the bacteria are eliminated, inflammation decreases and symptoms gradually resolve. It's crucial to use antibiotics responsibly to prevent resistance and ensure they remain effective for future infections. In addition to antibiotics, pain relief is often needed. Over-the-counter medications like acetaminophen or ibuprofen can help reduce pain and fever. Some people find relief with heating pads or drinking soothing fluids. Always consult your healthcare provider before starting any new medication or remedy. Drinking plenty of water is essential during a UTI. Increased fluid intake helps flush bacteria out of the urinary tract and dilutes the urine, reducing irritation. Staying hydrated also supports your immune system and speeds up recovery. Aim for clear or light yellow urine as a sign of good hydration. Rest is an important part of recovering from a UTI. Your body needs energy to fight off the infection and heal inflamed tissues. Taking time to rest, avoid strenuous activities, and listen to your body can help you recover faster and prevent relapse. Prevention is always better than cure. Good hygiene practices, such as wiping from front to back, urinating after sexual activity, and avoiding irritating feminine products, can help reduce the risk of UTIs. Staying hydrated and not holding urine for long periods are also important preventive steps. Some studies suggest that cranberry juice or supplements may help prevent UTIs by making it harder for bacteria to stick to the urinary tract lining. However, the evidence is mixed, and cranberry products should not replace medical treatment. They may be used as a supplementary preventive measure for some people. Probiotics, especially those containing lactobacillus, may help maintain a healthy balance of bacteria in the urinary and digestive tracts. This can potentially lower the risk of recurrent UTIs. Probiotics are available in foods like yogurt or as supplements, but always consult your doctor before starting new products. It's important to see a healthcare provider if you experience UTI symptoms, especially if you have fever, back pain, or blood in your urine. Early diagnosis and treatment can prevent complications and ensure a quick recovery. Don't ignore persistent or severe symptoms. Pregnant women are at higher risk for UTIs due to hormonal changes and pressure on the urinary tract. Untreated infections can lead to complications for both mother and baby, so prompt diagnosis and treatment are essential. Regular prenatal care includes screening for UTIs to ensure a healthy pregnancy. Some people experience recurrent UTIs, defined as 2 or more infections in 6 months or 3 or more in a year. Factors like genetics, anatomy, or chronic health conditions can contribute. Preventive strategies may include low-dose antibiotics, lifestyle changes, or addressing underlying issues. People who use urinary catheters are at higher risk for UTIs because catheters can introduce bacteria directly into the bladder. Proper catheter care and hygiene are essential to reduce this risk. Healthcare providers may recommend intermittent catheterization or other strategies to minimize infection. Sexual activity can increase the risk of UTIs, especially in women. Bacteria can be introduced into the urethra during intercourse. Urinating before and after sex, maintaining good hygiene, and using water-based lubricants can help reduce the risk. After menopause, women are at increased risk for UTIs due to lower estrogen levels, which can thin the urinary tract lining and reduce protective bacteria. Hormone replacement therapy or vaginal estrogen creams may help reduce the risk in some women, but always consult your doctor for personalized advice. People with diabetes are more prone to UTIs due to higher sugar levels in the urine, which can promote bacterial growth. Managing blood sugar and maintaining good hygiene are important steps in reducing the risk of infection for diabetic patients. People with weakened immune systems, such as those on immunosuppressive medications or with chronic illnesses, are at higher risk for UTIs. Their bodies may not respond as effectively to infections, making early detection and treatment even more important. Kidney stones can block the flow of urine and create an environment where bacteria can thrive, increasing the risk of UTIs. Treating kidney stones and maintaining good hydration are important steps in preventing infections in people prone to stones. Untreated UTIs during pregnancy can lead to complications like preterm labor, low birth weight, or kidney infections. That's why regular screening and prompt treatment are part of standard prenatal care. Pregnant women should report any symptoms to their healthcare provider immediately. Sexual health and UTIs are closely linked. Using condoms, practicing good hygiene, and communicating with partners about symptoms can help reduce the risk of infection. Open conversations and preventive steps are important for maintaining both urinary and sexual health. Certain hygiene products, such as scented soaps, douches, or powders, can irritate the urinary tract and increase the risk of infection. It's best to use gentle, unscented products and avoid anything that could disrupt the natural balance of bacteria in the genital area. Wearing tight or non-breathable clothing can trap moisture and create an environment where bacteria thrive. Opt for loose-fitting, breathable fabrics like cotton underwear to help keep the genital area dry and reduce the risk of UTIs. A healthy diet can support your immune system and urinary tract health. Foods rich in vitamin C, antioxidants, and probiotics may help reduce the risk of infection. Staying hydrated and avoiding excessive sugar can also make a difference in preventing UTIs. Chronic stress can weaken your immune system, making you more susceptible to infections, including UTIs. Managing stress through relaxation techniques, exercise, and adequate sleep can help keep your body's defenses strong and reduce the risk of illness. Developing good hydration habits is one of the simplest ways to prevent UTIs. Drinking water regularly throughout the day helps flush out bacteria and keeps your urinary tract functioning well. Make it a habit to carry a water bottle and sip frequently. To sum up, a UTI begins when bacteria enter the urinary tract, attach to the lining, and multiply. Your immune system responds with inflammation, causing pain and other symptoms. If left untreated, the infection can spread and lead to serious complications. Early recognition, prompt treatment, and preventive habits are key to maintaining urinary tract health. Understanding what happens in your body during a UTI can help you recognize symptoms early and take steps to prevent infections. Remember to practice good hygiene, stay hydrated, and seek medical care when needed. With the right knowledge and habits, you can protect your urinary tract and overall health. UTIs are common but manageable with the right approach. By understanding the process inside your body, you can take proactive steps to prevent infections and maintain your health. Always consult your healthcare provider for personalized advice and treatment. Stay informed, stay healthy, and take care of your urinary tract.